Good afternoon. My name is Dr. Brett Giroir. I'm one of the resident advisors here at TMCx and former CEO of the A&M Health Science Center and director of the science office at DARPA. Transitions of care, most importantly from the hospital to post-acute care, are fraught with breakdowns in communication, expensive delays, patient and family dissatisfaction, and most importantly, lapses in the quality of care that can often lead to readmission and even serious medical complications. Not surprisingly, patients, healthcare professionals, and now the federal government are demanding change and solutions. But as they say in Texas, we can't get there from here. Why? Because transition to post-acute care is currently fragmented, it is manual, and usually performed in the absence of data. I am here because The Right Place is a breakthrough solution for all stakeholders that will potentially save billions of dollars in cost while improving the care for millions. Here to tell you about this innovative solution is Katherine Chambers, co-founder and CEO of The Right Place.
Good afternoon. I need the clicker. Thanks. Good afternoon. I'm Katherine Chambers, co-founder and CEO of The Right Place, and we're helping hospitals discharge patients to post-acute care in a quicker, better, faster way. This is our co-founder, Dr. Alan Abrams, a Boston-based geriatrician who's been practicing geriatrics in the Harvard system for over 30 years. Dr. Abrams became frustrated with the way the discharge planning process was negatively impacting the outcomes of his patients. I've spent the past 15 years in the travel industry, perhaps worlds apart, but a partnership uniquely suited to fill this gap in care coordination. When I learned a little bit more about Dr. Abrams' frustrations, here's what really struck me. 40% of all hospital discharges require some form of post-acute care, and roughly half of those go to a skilled nursing facility or a SNF. Tragically, 24% of those patients are readmitted to hospitals within a 30-day time period, costing Medicare up to $17 billion a year and causing a negative impact on those patient outcomes. What's more, 80% of hospitals today rely on phone, paper, and blast fax solutions to manage this discharge process and communicating patient details with a network of SNFs they'd like to send a patient to. We can do so much better. We need to leverage technology for what it can do well. Consider the number of applications available to any of us to research a next hotel vacation with real traveler reviews, filtering, and online booking engines. Or the number of applications we have on our smartphones that enable us to book a dinner reservation tonight by filtering mechanisms on cuisine, ambiance, or even payment method. Shouldn't the same be available in healthcare? That's why we created The Right Place. Let me show you how it works. We first provide a mobile solution to the skilled nursing facilities so they can manage all of their bed inventory and incoming referrals on one easy-to-use application that's manageable to access 24/7 from anywhere. This really becomes a central reservations platform for them. And importantly, we can track the trends coming through this application compared to the whiteboard methods that are used today. From here, we can expose this data to other stakeholders, such as skilled nursing facility operating companies, so they can look across their portfolio of operators to see what types of trends on length of stay and case mix are coming through their facilities. We have an application that we're now exposing to hospitals for those discharge planners to identify a skilled nursing facility for a patient they're trying to discharge by filtering on location, ACO alignment, special equipment that the facilities may have, and those that have an available bed for a patient that needs to be discharged really quickly. Further, our application allows the hospital to observe what happens to the patients after they leave the hospital. This is a really important component as we move to more value-based care, and hospitals and ACOs are wanting to manage and understand the outcomes of their patients through the post-acute continuum. We've had great traction to date. We're live in over 60 skilled nursing facilities in the Boston market. We're just wrapping up a pilot with Beth Israel Deaconess Medical Center and 2 of the pioneer ACOs in the Boston market. Through the exposure through the digital health accelerator programs like HealthBox and now at TMCx, we're in good discussions with 4 health institutions here in Houston. And we're really proud to be the grand prize winners of the Athena Health's Innovation Challenge that was just announced last month. This is just the beginning. We think the right place has great application to serve other segments of the healthcare continuum and matching the right patients with the right place of care in a better, faster, smarter way. And we look forward to telling you all more about it. Thank you.